I'm delighted to be here today, and I'd like to thank Vicky and the ECPO for inviting me to speak. What I'd like to discuss today is obesity in the healthcare setting, and specifically opening an empathetic conversation with your doctor or between the doctor and patient. I think, first of all, we need to acknowledge how difficult and daunting it can be for a lot of people to talk about their weight. It's a very private and personal issue for people. It's hard to share personal details about our life, our eating habits, and our body. So I think as a doctor, I can never, underestimate how difficult it can be for a patient to talk about these things. Even though we know that obesity is not a lifestyle issue, it's not a willpower issue, it's a complex chronic disease. I think people who live with excess weight inevitably face the negative attitudes, stereotypes, and weight bias, and this can often prevent them from getting the best care and treatment that they need and they deserve. I think we also know that, as a disease, obesity isn't given the same time or attention as other chronic diseases, particularly in the primary care or general practice setting. And I think if we look at the reasons why a lot of doctors don't bring up weight, I think there's many studies in this area, and the three main points that come up are number one, a concern about offending people by bringing up their weight. I think a lot of doctors feel that they have limited time and resources to bring up such a sensitive topic. Perhaps the doctors have limited training or understanding about obesity as a disease and the effectiveness of treatment options. I know certainly when I was in medical school and during my training as a general practitioner, there was no specific training on obesity as a disease. And this is something I came to later in my career. I think, other reasons, some doctors may feel it's not their role to discuss weight. They may have personal issues with their own weight and for that reason not want to bring it up. And maybe they live in an area where there might be limited referral pathways. So by bringing up the conversation about weight, sometimes they may not know where to go with it after that. I think in the healthcare setting, it's fundamental to starting a discussion about weight for us as doctors to recognize the weight bias that exists in healthcare, and for some doctors to recognize their own weight bias. We shouldn't make assumptions about people based on their weight. We can't assume about their eating habits, about their lifestyle, their physical activity, or even their health based on weight. People are not defined by their weight. And I think we need to acknowledge this to help us open an empathetic conversation. I think when I see a patient, the first thing I try and do is explore all the causes of somebody's presenting problems and symptoms, to not immediately jump to a conclusion that their symptoms are caused by their weight. I think a lot of patients that I meet have had the experience that no matter what ailment or problem they go to their GP with, it's attributed to their weight. And this we know that weight can have an impact on health, but we can't automatically blame all of a person's problems on weight. We need to look past weight. I think as a doctor, weight is often brought up obliquely in a consultation. We might be discussing another medical problem such as diabetes or high blood pressure, and we use this as an opportunity to discuss weight. But for me, weight is an incredibly important issue in its own right, and it deserves time and attention, and it deserves its own consultation. My first step in opening a conversation is always to ask permission to the patient sitting in front of me to discuss weight. I might ask them, would you mind if we talk about your weight today? How do you feel about your weight? How does your weight affect you? I think this is integral to starting a sensitive and non-judgmental conversation. And I think it needs to be done at the appropriate time. Like I said, somebody comes in and sees us, it's not the first thing we're going to do. We need to deal with the issue at hand first. And then if the patient is open, we can start a consultation. And if somebody is open to starting a consultation, weight is not a door handle issue. It's not something that we discuss as somebody's leaving the consultation. It deserves time and attention, as I said. And I often will advise people to make a follow-up appointment specifically to discuss their weight so that we can focus on that and not get sidetracked by other issues. When doctors are discussing weight, it's absolutely paramount that we don't use stigmatizing language. We need to use person-first language. And, we may find this uncomfortable initially. It may not be the way we're trained. And certainly in society, it's not the way a lot of people speak. But I think we need to lead the charge in promoting person-first language. It's very, very important that when we're starting a conversation about weight, we need to consider our patient's previous experiences discussing weight. A lot of patients that I have met in the past might have had harmful or negative experiences talking to doctors about weight. Again, their weight is blamed for all their problems. Maybe they're blamed or shamed, or they've been patronized for years with the outdated and oversimplistic message that, you need to eat less and move more, which we know long-term isn't a treatment for the chronic disease of obesity. After we have acknowledged or asked the patient about their previous experience and shown that there is a lot of change that needs to happen in the healthcare setting, I think this opens us up to have a good conversation. As a general practitioner, one of the key skills that I think we possess is the ability to listen to our patients. Every person's journey and experience in life is unique. So listening to the person sitting in front of us, can give us an incredible insight into the challenges and barriers that they've faced. It can help us to collaborate, to come up with a personalized strategy to help them manage their weight. I think we need to also acknowledge that a lot of people living with obesity have made many repeated efforts to lose weight in the past, and with some varying success, and maybe they've experienced weight regain. So again, going back to those assumptions that we make in our weight bias. When I'm discussing weight, I try to employ the 5 A's framework for obesity management, which was spearheaded and developed by Obesity Canada and the University of Alberta. And I think this is a fantastic tool to help to structure the way we think about weight and help us, come up with a plan that is agreeable to the doctor and the patient. As I mentioned, we start off by asking permission to discuss weight. We may explore somebody's readiness to change. Do they feel that weight is an issue for them? Would they like to change it, and are they ready to do it now? I think following this, we'll do an assessment. We'll assess that we'll talk about their history. Maybe we'll do an examination if it's appropriate. We might arrange investigations. Really, we want to grade or assess the severity of somebody's disease. We want to look at the root causes and drivers and barriers that they experience. And the 4 M's of obesity management are instrumental in this. We look at the impact on the quality of life and perhaps the comorbid or associated medical conditions they may have, or complications that are associated with their weight, or just other things that contribute to difficulty managing the weight, like medications or mental health issues. There's the list is huge. When we move on to advising somebody, we can talk about the health benefits of managing weight and how a relatively small reduction in weight can have a significant effect on medical outcomes long term. We talk about, we advise people on the long-term strategies and treatment options, and we agree on a collaborative approach, looking at expectations, goals, and personalize the plan for each individual. And after this, we can assist them. It might be education, it might be pointing them in the direction of resources, and often, I think one of the most fantastic things about collaborating with my patients is some of the best information and resources in education that I have come across has been shown to me by my patients. So I think, always being ready to learn, always being ready to open our mind is integral. I think, assisting people in identifying and coping with barriers, and definitely arranging for a follow-up. The chronic disease of obesity is not something that happens overnight. It's certainly not something that we can cure. It's something we manage long term. And it's something that, in 15 minutes of a consultation, if that's what we have, we're not going to solve the problem. Our initial consultation, we might open the discussion, we might explore the patient's experience and make a plan. But we're going to need repeated visits to tackle this issue. I hope that I take a holistic approach to looking at things. We mentioned looking at the root causes, why somebody might struggle, the barriers that they encounter. But I think it's incredibly important that we don't just focus on the scales and the numbers that we see. It's important that we try and help people to improve their health and not just lose weight. In my opinion, there are many other markers of success, not just the numbers on the scales. I think, as a doctor, we have to be conscious of in the consultation, that we have to be careful not to maybe share our own weight loss stories or anecdotal, helpful tips that people, don't often find as helpful. This can add to weight bias and stigma. We need to focus on evidence-based treatments. In our clinic environment, it's very important that we make this friendly and welcoming and a safe space for people. And this might mean removing stigmatizing material from the waiting room, magazines, posters, making sure that it's accessible, making sure that we have perhaps armless chairs that can support somebody living in a larger body, with their size or shape. The equipment that we use, having appropriately sized blood pressure cuffs, gowns. If we're going to ask somebody if it's okay to weigh them, we need to have a scales in a private setting. That maybe the display is not immediately visible to the person if they don't want to see. But again, this is another thing that I think it's important to ask is, how do you feel about us checking your weight? And some people will be okay with it and some people not. I think the staff in our practices need to be kind of coached and guided in person first language also. The other thing that has really come out in recent times, particularly since the start of the COVID pandemic, is the opportunity for virtual consultations, telemedicine, communicating with our patients in a different way. And a lot of doctors might find this unfamiliar territory. They may feel out of their comfort zone, but it really does remove a lot of the barriers for our patients. It's a safe, comfortable environment. They're in their home setting. It's convenient for them. And really, this is the essence of patient-centered care. Although the doctor might feel a little bit more uncomfortable, I think you can get a comfort and you can still build that one-to-one collaborative approach and trust. When I'm talking to people about, bringing up the conversation about weight with their doctor, there's a few kind of, tips that I'll often discuss. I think it's very important that we do book a visit specifically to discuss weight and make sure that weight is highlighted as the topic for discussion. So the doctor knows in advance that this is what's going to be discussed. Having, thought about and maybe prepared a list of questions or concerns, thinking, before the consultation, anticipating, the questions that the doctor might ask. So thinking about our past history, the pattern of weight change, maybe looking at, what might some of the triggers or factors be that influence our weight and what have we done in the past to try and control our weight. Bringing a list of current medications can be very helpful too, particularly if it's not your regular doctor. And I like people to think about the reasons why they want to lose weight. What values do they have? What are their, goals long term? I think we need to have a realistic expectation for the encounter. And as I mentioned, this is a chronic medical condition, and often the first step is opening the conversation. I think during the consultation, not just doctors, but patients, I think also need to be, careful not to be self-critical in their language, not to use stigmatizing language, because we know that internal weight bias, is a huge factor and certainly an incredibly negative thing that can help people or hinder people in managing their weight. I think I always like when patients tell me if they feel comfortable with having their weight checked. I'll ask, but it's nice if they can tell me. I think, perhaps the person wants to consider, bringing up the topic of referral pathways or treatment options, and definitely making a plan for follow-up. So in summary, I think, we know that obesity is a complex chronic disease. We need to end the weight bias and stigma that exists not only in society, but in the healthcare setting. We can't make assumptions about people based on their weight. It doesn't define people. We need to consider all the potential causes for somebody's symptoms when they present to us and look beyond weight. We should not be, shaming or blaming people or patronizing them with the, outdated, thoughts about obesity. We need to focus on evidence-based medicine. We always need to ask permission to discuss weight. I love the 5 A's framework for managing obesity. We need to be supportive and encouraging in our advice and focus really on health gains rather than weight loss. So thank you very much for listening to me, and I hope that everybody can please continue to support the campaign using the hashtag #LivingWithObesity. Thank you very much.